The acid test of any high-performance organization is, can you walk into a medical center and ask the person in housekeeping how what they're doing that day contributes back to the vision of the major organization, the larger organization. That's what we're shooting for. It's like if you ask the person sweeping the floor at Kennedy Center what they're working on, and they answered, I'm putting a man on the moon.
Hillary Clinton got some attention recently when she said the VA scandal has not been as widespread as it has been made out to be. Do you agree with her?
I told you we've made progress and we have more work to do.
CNN reported recently that long waits continue for many VA patients seeking medical services. In August, more than 8,000 requests for care had wait times longer than 90 days at the Phoenix VA. Why do these delays continue, and what can be done to cut down on the wait times?
I think I addressed that too. 78% of veterans have a choice, and they had that choice even before the Choice Act. 78% of veterans have Medicare, Medicaid, their own private health insurance. So 78% of veterans have a choice. They exercise that choice. Today, on average, the average veteran, and of course there is no average veteran, but the average veteran uses VA for 34% of their medical care. Only 34%. Now that 34% might be the hearing aids I talked about that save $4,000. Or that 34% might be the knee replacement I talked about that saves $5,000. Only 34%. As we have improved our care, as we have improved our culture, as people have learned about the great things that the VA does, as we've opened up more facilities, as we've hired more providers, more people are coming. More people are coming, and those already in the system are looking for more of their care from VA. If that 34% becomes 35%, a 1 percentage point increase, I need a $1.4 billion budget increase from Congress. $1.4 billion for a single percentage point. And as many of you know, the budget problems we got into last year because of a miracle hepatitis C drug that was invented in 2014, 2015, that budget was talked about 2 years before that. So we're going to have to do something with our committees to create the kind of processes that exist in business for how you have budget flexibility and agility to meet customer demand. Otherwise, what's going to happen is as more people come into the system, if we don't get that budget flexibility, then the appointments might not be within 30 days. Maybe the average mental health appointment, well, not mental health, that would be a bad example, but maybe the average primary care appointment has to go from 4 days to 5 days or 6 days because the budget is given to us by Congress and the benefits are defined by Congress. All we're trying to do is make the two match.